of neglect. Winston Gregg, admitted to Alberton after a motor vehicle accident. The nurses kept calling the doctors for over 24 hours. They were totally ignored. The patient died without treatment from a ruptured liver. Carlton Sanchez fell in a tub of hot molasses and was being treated for burns at Halberton. He then started vomiting blood. Nothing was done. He bled to death. An 8-year-old boy was told at Halberton that he had appendicitis. They operated on him, but no appendicitis was found. Soon after surgery, Madam Speaker, he started having respiratory distress. A house doctor was called. Without any evaluation whatsoever, he directed, that is the doctor, to give the 8-year-old boy pethidine. The 8-year-old boy died 7 minutes after. 7 minutes after. Erika Oscar, a patient with sickle cell disease, came into Alberton complaining of pain and breathing problems. They did nothing for her. She suffocated to death. Kamali Joseph, another sickle cell patient, went to Alberton complaining of pain. He was admitted and totally ignored by the doctors. He was found dead in the hospital bed 2 days later. Found dead in his hospital bed 2 days later. Kamali Joseph. A 13-year-old showed up at casualty, Madam Speaker, 3 days in a row during the last 2 weeks of complaining of pain. On the 4th day, the doctors advised that she be given Adamon. She died shortly after. Quite apart from the fact that Adamon should not be given to children. Adamon is never given to children. This unfortunate teenager was clearly overdosed. Those are the horrors that are going on. A lady named Viola, she was taken to the operating room, Madam Speaker, at Harberton for a simple procedure called gastroscopy. The patient died in the operating room during the procedure. And up to this day, family members have not been told why she died. Lisa Frederick, Madam Speaker. Hers is the case of the simple procedure of putting a central line in her neck. Somehow, they ended up cutting the jugular vein. She too bled to death, Madam Speaker. There is also the very recent case of a patient, Madam Speaker, on whom a minor procedure was done, in which an IV line was placed in the neck. The patient was found dead in a pool of blood hours later. We all know of the jockey, Omari Wilkins from Upper Gambles, who fell off a horse.
Madam
started
Speaker,
speaking about it.
I rise.
Started speaking about it.
Madam Speaker.
Complaints of abdominal pain.
Honourable Member.
I rise on a point of order. You will have to sit if you want me to say it. Turn your mic off. Madam Speaker, according to the rules, if one is going to give these sort of, make this type of accusation, one would have to have the evidence in order to show, because
Point of order, Madam Speaker.
you're not the
Honourable
speaker.
member, I will rule on that.
You're not the speaker. So what I'm saying, Madam Speaker, I go by your rules and your judgment, but the fact of the matter is, I think that these...
Honourable members, I rule, not you.
Madam Speaker, I will request, for the benefit of those of us on this side, that whatever the member was reading from in connection with these accusations, that it be made available to the Parliament so that we can look at it, because what is happening here, Madam, is seriously undermining the health situation in the country and making people believe that anybody that go to the Halberton Hospital is going to die. So I am just saying, Madam Speaker, I would wish that you will allow for the gentleman to make the information he has available to the Parliament.
Honourable member, I find that your request is reasonable. It's in keeping with the traditions of this House, that any documents from which you read, documents which you refer, are passed on for the benefit of the other members. And I think the request is reasonable, so I will ask that the Sergeant-at-Arms, I hope, please, I hope that it's an identifiable document. It is? Is it an official document that you're reading from? Okay, so please, would you make available to the Sergeant-at-Arms so that copies can be made? Thank you.
I will adhere, Madam Speaker.
If the gentleman has an official...
You rise on
the point, continuing the point of order. Because if he has an official document, then he needs to say particulars of that document, if it is official.
Yes, that is why...
You can't say that it is official and just leave it at that and
yes,
continue.
Yes.
And tomorrow we find it is not an official document.
Your point is taken, which is why I asked if it is an official document and not just a compilation of his own making. He assures me that it is official. It is an official document, so I will need, of course, my own copy.
I will adhere, Madam Speaker. Madam Speaker, I will make the available. And I also can, Madam Speaker, after, make the patient records be available to. I will.
I just want you to make available anything to which you refer in this,
Yes,
in this presentation.
I will. Madam Speaker, we all know of the jockey who fell off of a horse and was hospitalized with complaints of abdominal pains. On the 4th day of hospitalization, he was discharged by doctors at 8 a.m. At 10:30 a.m., when the nurses arrived to execute the discharge, they found him dead. The autopsy revealed he had a ruptured bowel. There is also the case, Madam Speaker, of the Grays Farm man. His sister is actually a nurse in the Grays Farm clinic, who was involved in an accident and had to be taken to the hospital to be operated on immediately. The operation took place the following afternoon at 3 p.m., by which time it was too late. The young man died on the operating table. As tragic as it is, though, this is just a sample, Madam Speaker. They don't want to hear the truth. They want to be told the truth. They want to hide the truth. The families, some of them, have already instigated legal action against the government. There are many more, Madam Speaker, many more. And so I asked the Health Minister, how many more must die? How many more? With these specific examples, Madam Speaker, from the last 18 months, I'm sure the people of this country can understand that what we are dealing with is not merely medical malpractice, Madam Speaker, but it's criminal negligence. Criminal negligence, Madam Speaker, and in its most deadly manifestation. Right track?